All right. So I see that we've had some of the numbers slow down as far as people coming into the room. I know we'll have a few more probably trickle in as we get started, but we do want to just go ahead and say hello and welcome as we go ahead and start with today's webinar, which we've titled Community Solutions to Climate Change Challenges. The Vaccine Equity Cooperative, part of the expanding Health Equity Community Collaborative, is pleased to host this webinar in partnership with Health Leads and all of you who are part of our growing network of partners on the webinar today. I'm Jacqueline Dalton, Director of the Health Equity Community Collaborative, or HECC, and I am pleased to be your moderator today. Because we are talking about climate and that pertains to an area or place or space, I want to acknowledge and take a moment to acknowledge the land that I am bringing you greetings from today, which is most commonly known as Nashville, Tennessee, but also known as the indigenous territories of the Cherokee, Shawnee, and Yuchi people. So before we get into our conversation today, we have a few things that we want to just remind you all about and make sure everyone is aware about. So if we can go on to the next slide. This webinar is available in Spanish as well as American Sign Language. To listen to the presentation in Spanish, you will click the globe icon, the interpretation icon at the bottom of your Zoom screen and select the audio language Spanish. To follow along in ASL or American Sign Language, click the globe interpretation icon at the bottom of your screen or Zoom screen and select your visual language. And you should be able to see that interpretation there. This webinar also has a closed captioning option. And to enable the closed captioning option, please click on the closed captioning icon or the CC at the bottom of the Zoom screen. And I have a few other housekeeping items I need to mention before we move on. One of those is that today's webinar is being recorded, and we will send the recording out to everyone who registered today, along with any materials that we share, which includes the slides. So, as I said, if we have a few folks join late and they ask about the slides later in the chat, please feel free to let them know politely that yes, we will. We've got you covered. We'll send the slides out. Secondly, during today's webinar, we'll have time to answer as many of your questions as possible after we have a short presentation from our panelists. So please submit your questions if you have not already using the Zoom Q&A button found at the bottom of the screen. And then also we want to point out that you can use the Zoom chat feature, which many of you have already doing to introduce yourselves. We have reactions and links that you might want to share. So feel free to drop those in the chat and our team will try to pick those up as relevant to include and share out later as well. And then last but not least, at the end of the webinar, we will launch a poll, and that poll is an evaluation survey. So please do take the time to complete the feedback survey on today's webinar and let us know your suggestions for what you'd like to see for these webinars in the future. All right, next slide, please. So for many years, actually, climate change has been too politicized to be addressed with a proper public health lens. Yet climate events have been so frequent in the last few years that the conversation can no longer be ignored, right? We've seen rising temperatures and wildfires ravage communities, and even the impact that climate change has had on food and water insecurity. In my own communities, neighborhoods are often strongly impacted by adverse weather events like tornadoes and even flash flooding. And all of those of which I've named are only in the United States. So we can imagine that the impact globally, right? Some of us may already be aware of some of that impact that climate change has had globally. So this tends to raise the question, and we've heard the question from you all, of what truly is climate change? How do you define it? What is being done at a local level to address climate change impacts, and also not only how are folks recovering, but how can you prepare from some of these drastic weather events? And finally, how does climate change connect to health and health equity? And so we've invited our panelists today, 3 climate experts, to help us answer some of those questions. And I'm thrilled to have Kendra Beaver from Fairmount Indigo CDC, Gary Cohen of Healthcare Without Harm, and Dr. David Paget, representing the Tennessee State University. And all of their bios will also be linked in the chat as we introduce them. So you'll have an opportunity to get more information about them from those links in the chat. All right, and if we can go on to the next slide. As a reminder, these are the objectives that were listed when you registered for today's webinar. During our time together, we plan to, one, introduce the connection between climate change and health equity, two, highlight examples of community-based organizations implementing local climate equity solutions, and also share resources and tools that can be used to solve for health inequities caused by climate change. All right, so I think we're ready to get started. So first we have Gary Cohen, who is president and co-founder of Healthcare Without Harm. He is an international coalition, or Healthcare Without Harm is an international coalition of organizations that partners in 50 countries to work on reforming environmental practices of the healthcare industry. Gary is really well known as a pioneer in the environmental health movement, and he's also a board member of Health Lead. So we're excited to have him today to talk about the connection that I mentioned between climate change and health equity. So I'm going to go ahead and turn it over to you, Gary. Thanks for being with us today.
Thanks so much, Jacqueline, and thanks to Health Leads for sponsoring this webinar. So let's just get right into it. Can I have the first slide? For more than 20 years, when you ask people, what does climate change mean to you? What is the image that comes to you? People would have said, well, polar bears on melting ice caps, receding glaciers. And what we are now seeing is that the climate crisis is a health crisis, that there is an enormous set of health impacts related to the climate crisis, whether it has to do with extreme weather events, it has to do with just rising temperatures, it has to do with air pollution, has to do with events that make people refugees. And also we're learning more and more that it has a lot to do with mental health. Next slide. So this is a slide from the Center for Disease Control that kind of lays out the whole dimensions of health impacts related to changes in vector ecology. So malaria that was in Panama 25 years ago is now in Texas and Florida. More air pollution means more asthma. More severe weather we're seeing means more mental health, more fatalities, injuries, loss of home, mental health issues. The UN says that climate refugees will be the largest share of refugees in the world, outstripping more refugees within the next decade. And then as water gets contaminated through extreme flooding, you have all sorts of diarrheal diseases, malnutrition. And of course, this has been the hottest year on record. And so we see already now more hospitalizations, more heart problems, et cetera. So this is a useful slide to hold on to in the future. Next slide. Fossil fuels is at the heart of this. The burning of fossil fuels, regardless of whether it's driving the climate crisis, is killing millions of people each year from particulate matter. So Harvard did a study a couple of years ago that said 1 out of 5 people on the planet died from prematurely from the combustion of fossil fuels. So fossil fuels is at the very center of both air pollution and the climate crisis, and also the pollution of our democracy. The next slide. We know, and you guys have been focusing on how COVID was a force multiplier for all the racial and economic and health inequities that we face in our society. Climate is that same force multiplier that accelerates all of the problems that we already suffer racially. Next slide. And there's some statistics that are from studies that you can double click on that show that fact. Black people 3 times more likely to die from polluted air, Native people having the highest rates of heat-related death, Latinx people 43% more likely to live in areas with the highest projected reduction in labor due to extreme weather events. And even now, farm workers are fighting just to get a break to go drink water. Okay, so there's all of this stuff happening. People with disabilities more likely to die, LGBTQ people, higher rates of chronic diseases related to pollution. It goes on and on. And that research is now accelerating and coming out more and more. Next slide. So on top of the general extreme that are happening in terms of hottest September on record, et cetera, more and more are extreme weather events. So just in the last 9 months, there's been $23 billion weather and climate events all across the country. So it does not distinguish between red states and blue states. It is happening all over the country and all over the world at this point. That acceleration is happening. Next slide. Healthcare, the health sector, public health, healthcare systems are at the very center, the epicenter of this collective trauma. They are, when wildfires happened in Santa Rosa, California, 2 major hospitals had to be evacuated. During Katrina, almost all of the hospitals had to be evacuated. In Pakistan last month, when 1/3 of the country was underwater, 2,000 health clinics were underwater. So what we've realized is that healthcare and our public health infrastructure has not been prepared for the massive dislocation, the massive impacts that the climate crisis and extreme weather events are having on our communities. Next slide. The irony here, or I won't get to that. What we believe at Healthcare Without Harm is that as the one sector of our society that has healing as its mission, we think that healthcare needs to leverage all of its assets, its ethical, its economic, its political influence to create ecologically sustainable, equitable, and healthy communities. It has more purchasing power, it has political power, it's usually the largest real estate owner in a city, it has enormous credibility. And so how can we leverage all of that to build more equitable communities? Next slide. So just a word about Healthcare Without Harm. We started 27 years ago. We started with mercury. We started with one hospital in Boston to eliminate mercury because it's a neurotoxin and it was poisoning the environment and poisoning people's bodies and our oceans and our waterways. And we started with one hospital. 13 years later, we won a global treaty phasing mercury out of healthcare. That has grown to an enormous network across 82 countries, all working on climate smart healthcare now. Next slide, just to say. So healthcare has this incredible paradox, which, as I said, is at the very center of response. And it's also a large climate emitter. So it embodies all the contradictions of an economy built on fossil fuels, toxic chemicals, and industrial agriculture. If healthcare was its own country, it would be the 5th largest climate polluter on the planet. And yet it has this incredible opportunity to lead the rest of society out of this addiction to fossil fuels. Next slide. To give you a sense from the US perspective, the US healthcare system is 25% of global healthcare emissions, almost 10% of US emissions. So US healthcare has more responsibility than any other system on the planet to lead, to address its own climate footprint, to clean up its act, and to model actually this transition. They have more responsibility than anyone else. Next slide. So our strategy sees this is one, healthcare has to detox and decarbonize its system. Energy, food, anesthetic gases, plastics, buildings, waste, all of it. It needs to anchor the resilience of communities, partnering with others to do so as a community anchor. And it needs to leverage its voice, nurses, doctors, public health people, to change the narrative on climate and to be focused on health and equity. That's our strategy, where health is equity is at the center of this thing. Next slide. So I'm not going to talk about the decarbonization work because that's a whole other matter. We could do that futurely. But what we have said and what we've tried to document through case studies is that healthcare cannot be the 800-pound gorilla saying, we're going to save you. In this context, they need to partner with communities because communities have assets, knowledge, public health people have knowledge about what is it going to take to help understand the vulnerabilities of the communities that they serve, and then to partner to go together to solve for these problems. And I'm sure you're going to hear from others about that. So these are some resources that actually make the case for resilience in health in healthcare in the communities, and then show examples of how do we build a table that's more democratized to partner around these issues. Next slide. No, I'm almost done. So we've built some networks around nurses, a healthcare climate challenge to educate nurses to become advocates around that. It's free, easy to join. We've also got a health professionals network. And what's happening also in all these different disciplines now is that health professionals are waking up to their own responsibility to address their own clinical practice, as well as being advocates to their systems and actually in the public sphere. There's no more trusted profession than nurses, doctors, and then pharmacists, actually. Next slide. Couple of quick case studies just to sort of give a sense of things. So transportation is a huge issue. It shows up on community health needs assessments all the time. And there's some examples of Rochester Regional Health installing bike infrastructure and EV charging stations for the community, low-cost car sharing program for the community. Innova Health for its employees provided transit passes so people can, all their employees can use public transportation. Obviously, telemedicine is another example of that. So you don't have to go to the hospital to be treated for some things or have a consultation with your clinician. So there's a lot of movement now to actually leverage transportation strategies with the community to address climate and transportation issues and pollution. Next slide. Another example of a really leader in this space is Boston Medical Center. In addition to sort of addressing these sort of housing and food upstream issues, we worked with them to put a farm, a rooftop garden on one of their facilities in Boston, and they're now growing crops that are feeding people in the hospital, that are part of their food as medicine strategies, that are going to others who are food insecure in the communities. And just this past week, they announced this incredibly cool strategy to use Inflation Reduction Act funds to offer clean energy prescriptions to low-income patients to offset their monthly electricity bills using the money they're saving from installing these solar panels. So super, super interesting model to link climate, health, and equity. Last couple slides. Is that there's momentum now in the sector to move this. The National Academy of Medicine has this whole strategy to decarbonize the healthcare. There's a new Office of Climate Change and Health Equity that's launched a healthcare climate commitment to decarbonize the healthcare sector and make it resilient. The Joint Commission is now getting involved. So it's a huge momentum that's happening in the sector. Next slide. The Biden administration is also trying to center a lot of these investments through the Affordable Care Act, through Justice 40 initiatives on communities that have been heavily impacted by fossil fuels, who have been dependent on fossil fuels for their economies. So there's all this money that's floating around and available to move this agenda around climate, health, and equity. Next slide. And there's a lot of this happening globally. So USAID is actually solarizing 10,000 clinics in Africa. It's a resilience strategy in places where the grid is not secure. It's a climate strategy in terms of mitigation. And it's actually a universal healthcare access strategy, because when you have reliable energy, then you can do surgeries at night. You can have births at night. Last slide is that this relates to universal healthcare access. We are now at a place on the planet where the health of billions of people are well beyond their individual control. because of the climate crisis, because of pollution, because of the loss of biodiversity. So the argument for why everybody needs to be protected, why we can't leave anybody behind, is as powerful as it's ever been. And I'll leave you with this last slide just to say this is what it means. Yeah, there are so many positive benefits from addressing our addiction to fossil fuels and toxic chemicals. And the only thing that's getting in the way of this now is the power of the fossil fuel industry. I'll stop there. Thanks very much.
Well, thank you so much, Gary. That was a very quick bird's eye view with a lot of information about climate change and connecting those to several health issues that we are seeing increase more and more. So we're interested in coming back to you for questions, but we're going to keep moving. So again, thank you, Gary. Now we're going to go over to Dr. David Paget, and we're going to hear from him. Dr. David Paget, again, is an associate professor of geography and director of geographic information sciences, or GIS, at Tennessee State University. He's another environmental health justice expert and someone I've known for many years as Mr. GIS. So I'm very excited to have David here with us, and he's going to share a little bit about his work and how he's partnering with local communities to tackle climate change. So I'll turn it over to you.
Good afternoon. Yeah, I don't have any slides or anything. I just wanted to share just some of the current and recent past projects that I've been working on with regard to climate change and connecting with communities. I guess the first and longest project that I've been working on, which is funded by NASA, is the Global Learning and Observations to Benefit the Environment program, globe.gov. And it's a program that is, it's an initiative that has its primary objective of improving science education at the K through 12 level through hands-on scientific inquiry. And one of the learning activities involved in GLOBE is the surface temperature observation. So we literally take infrared thermometers. And when I say we, I mean teachers and students literally all over the world take surface temperature observations using the infrared thermometers, and we compare those readings with liquid filled thermometers to get current temperature. And by engaging in hands-on scientific inquiry, we start with elementary school, middle school, high school children and start there so that they get an understanding early on about the effects of global warming upon urban areas. We talk about tropospheric ozone, or low level atmosphere ozone, and how that gas, when it's human created, can trigger asthma attacks, as opposed to the good ozone, which is 6 miles above us in the stratosphere, which protects us from ultraviolet radiation. That ozone is good ozone. And so we start with kids and get them to understand that, you know, when we look at the surface temperature of this asphalt versus the surface temperature of the grass over here on any given day, it could be 10 degrees Celsius warmer or more on the asphalt. Then we can start talking about how do we mitigate that? Maybe with green roofs, or maybe with lighter colors, and so on and so forth. And so the global reach of the GLOBE program really gets us like down to the young people who are going to be making decisions in the future about how our cities are designed and about how we do things, so that mitigating urban heat won't be such an odd concept for them. Secondly, I've been collaborating with the NASA. Again, NASA is now doing engaged with environmental justice, and this is brand new. NASA is collaborating with environmental justice organizations. I'm currently involved with two NASA environmental justice projects, one in New Orleans, I was just there last week, and one it's in Atlanta. The one in Atlanta specifically focuses upon urban heat. And so we have brought in environmental justice organizations to public meetings and actually share with them data layers such as the urban hotspot layer. And people can see exactly how much more elevated in temperatures their neighborhoods are versus others. And then that gets us to start thinking about mitigation strategies such as tree planting or mitigation on a personal standpoint, where people should be aware that if they do have an asthmatic child, that there are certain days that certainly might be okay in terms of ozone in across the entire city of Atlanta. In their particular neighborhood, it might not be safe to have that child outside. And so we can clearly show that with NASA data, NASA satellite data, that's pretty easy to acquire and obtain. And so the challenge in introducing this NASA data to the public is that most people, when they think of NASA, they don't think about anything having to do with climate change. They think, rockets, they think Mars. They don't think about Earth science and atmospheric science. But NASA has a lot of data, and what's happening now is NASA has a whole open data initiative. The acronym is TOPS, TOPS. And so NASA wants to make all of its data openly available for public use. And the challenge is, to make people aware of this climate data that can show urban heat islands and urban hotspots, and also, show them exactly how it can be applied in activism in terms of cooling cities. And so when we look at all of these issues, one interesting project I had a couple of years ago was we developed a urban climate justice initiative in Detroit, specifically for young people between the ages of 13 and 18. And at first, the kids really weren't interested at all. They just were there. They were going to get a stipend check. They just figured, let me ride this out and get paid. But when they saw, using some of the data visualizations, when they saw how different their neighborhoods were in terms of temperature than other neighborhoods, they got into a whole other discussion. I mean, we adults were just sitting there, and the kids were talking about how come there aren't as many trees in our neighborhood as others, and why don't we have this and that in our neighborhood, and maybe we can put in some urban gardens. I mean, these were kids who got a hold of this information using these data visualizations. And most recently, when Nashville participated in a NOAA funded or NOAA supported campaign to look at urban heat islands and urban environments in terms of heat, I was asked to create a map. And that was my small contribution, was to create a map of the different neighborhoods with regard to demographics and socioeconomic status, because the NOAA Urban Heat Island program, it involved volunteers who had sensors on them, and they rode or walked and took temperature readings in their neighborhoods. And I wanted to make sure that there was an equitable distribution of those sensors, because of course people who are more privileged or come from more highly educated backgrounds, of course they're going to jump on board and yes, I want to volunteer and yes, I want to be involved with this project. Whereas in other communities that might not be as economically advantaged, they might not be, they're busy. You know, they're trying to feed their kids, they're trying to feed their families, they're trying to go to work at 2 or 3 jobs. They might not necessarily have time to be involved with urban heat islands research. But you know, I created a map and just showed a layer of that same NASA data that showed the coincidence of some of the hottest parts of town, temperature wise, and some of the lowest income parts of town. And I think that from what I saw in that resource that I shared earlier, that the NOAA did a pretty good job of being inclusive, that all segments of Nashville were selected to volunteer for that particular project. So we got a pretty good sense of where attention should be paid on the part of Nashville with Nashville's climate change mitigation initiatives, so that those who are most vulnerable to urban heat and air quality degradation associated with low level atmospheric ozone can receive the greatest amount of protection or an adequate amount of protection so that you know, they won't suffer disproportionately. So
And Dr. Paget, one of the links that you also shared with us was a sort of like a checklist about climate. And will you just say a little bit about that checklist as it relates to some of the things that you are mentioning of work that you are doing in partnership with some of these local communities?
yes, let's see. Yeah, so there are things that cities can do. You know, so you know, the cities can do to lower the risk of urban heat and protect vulnerable communities using geospatial data, which is essentially, you know, what I do, and the approach that was taken by NOAA and the other projects. So that checklist is more or less for municipalities, cities, governments to use to make sure that they're covering all bases with regard to the challenge of urban heat. And really the data is needed because one of the main problem is not necessarily that it gets hot. The main problem is that it does not get cool at night. And so I was in New Orleans earlier this summer one week, and it was 102 degrees Fahrenheit during the day, actual temperature. The heat index was 116 degrees Fahrenheit. At night, at 1 o'clock in the morning, it was still 90 degrees Fahrenheit. That's extremely dangerous. And that's because if there's people who don't have air conditioning, if there's a normal cooling at night that gets down to maybe 75 degrees Fahrenheit, then you can open the windows up and put a fan in the window and maybe have some relief. But if it's still 90 degrees Fahrenheit at night, there's no chance of any recovery on the part of people. And it can, especially an elderly person or somebody who's vulnerable, can easily succumb to some form of heat stroke, exhaustion, or even death, as we've seen.
Right.
And
And
so
I sort
that's
of I apologize. I thank you for mentioning that. And I sort of want to pin a pin in that point because we do have some questions about vulnerable populations. So I do want to come back to you when we get to our Q&A, but I do want to take a moment to go over to our third panelist, but we will come back to you, Dr. Paget, particularly about those vulnerable groups and what you're seeing the impact is for them. Before we go over to Kendra Beaver, I want to just recognize as well that we have a couple of hands up. Karina and Samantha, we do see your hands, and we will come to you during our Q&A if you do want to go ahead and put your comment in the chat, you're welcome to do that as well. Thank you. All right, and so I'm going to go over just quickly to Kendra Beaver, and Kendra has a few slides prepared for us as well. She is a climate justice coordinator from Fairmont Indigo CDC Collaborative. And again, this is Beaver's full bio was put into the chat, but she's another climate expert who is doing local work with her community-based organization to address climate, and again, has a few slides to tell us about her organization and what climate change looks like in her work. Kendra, I'll turn it over to you.
Hello, everyone. Can you see my slides?
Yes, we can.
Great. It's good to be with you all. So first, I'd like to share some information about who the Fairmont Indigo CDC Collaborative, FICC, is and the work that we do. I like to describe FICC as sort of an umbrella organization of 3 community development corporations, or CDCs, in Boston, Massachusetts. We serve the communities that are united by a specific train line called the Fairmont Line, which you can see in the purple line on this map. We have 5 goals at FICC. The first being supporting and empowering our communities to build collective political power. The second is increasing economic and wealth building opportunities through well-paying jobs, skill building training, and other means. The third is acquiring and developing affordable housing to prevent speculative displacement and gentrification. Number 4 is bringing climate justice, sustainability, and health equity to our communities by activating grassroots support for policies and practices that further these goals. And the 5th goal is promoting equitable public transit that meets the needs of the communities that it serves. The communities FICC serves used to watch the Fairmont Line go back and forth through their neighborhoods, but they had no way of getting on the train. FICC was formed in 2004 when our 3 member CDCs realized that they had a shared goal of improving transit equity in our communities. So they came together as a formal collaborative to see these goals through in partnership with other CBOs and residents. And excitingly, after over a decade of work, our campaign to build 5 new stops on the Fairmont Line was successful. Now, FICC's focus is on community organizing and policy advocacy for specific policies that would further climate justice and health equity in our neighborhoods. And we know that climate and health are deeply connected to other issues that FICC prioritizes, like housing, transit, and jobs. FICC's neighborhoods are environmental justice communities as defined by the state of Massachusetts, which considers race and ethnicity, median income, and language isolation. Another term I'll use today is the Fairmont Corridor, which is the group of neighborhoods that the Fairmont Line runs through and which we work with at FICC. They are primarily an immigrant, BIPOC, and low to median income community, and 1/5 of the population of Boston, 83% of whom are Black or Latinx, lives within half a mile of the Fairmont Line. So I've been talking a lot about the Fairmont Line, so let me tell you a bit more information about it. It's a 9-mile long commuter rail line that runs from the heart of downtown Boston southwest to Boston's southernmost neighborhood and back. Despite it being called part of the commuter rail system, evoking images of suburban commuters going in and out of the city during rush hour, the Fairmont Line starts and ends entirely within the city of Boston. So it's a unique train. There are 9 stations on the Fairmont Line. Trains come every 45 minutes, and the line is unfortunately fueled by diesel. The Fairmont Line has seen its all-time highest ridership this year because it serves as a critical connector from some of Boston's most underinvested neighborhoods to the resources, jobs, schools, and hospitals that downtown Boston has to offer. So how does climate change impact the Fairmont Corridor? The Fairmont Corridor experiences extreme weather events like intense storms and rain. We have more severe heat islands compared to other parts of the city. We experience stormwater flooding and storm surges, and we experience higher levels of climate change causing air pollution, which also poses threats to residents' respiratory health. And all of these impacts do further damage to people's health, safety, and wallets. For example, on average, residents of color in Massachusetts are exposed to air pollution from vehicle emissions, which includes trains, that are 26 to 36% higher than the exposure of white residents. Further, the section of the Fairmount line between two stations, the Blue Hill Avenue station and Upham's Corner station, has the highest number of asthma incidences in the entire city of Boston. And the areas near the Fairmount line skew higher in particulate matter levels. The Fairmount corridor is a key example of where climate justice, health equity, and transit justice intersect. And because of the disproportionate impacts that climate change has on the corridor, I'd like to highlight one of FICC's campaigns to ameliorate these impacts. That campaign is called A Better Fairmount Line. We collaborate with a coalition of organizations in Boston called the Fairmount Indigo Transit Coalition on this campaign. And our campaign demands are full electrification of the Fairmount line to reduce the diesel emissions that are spewed into our neighborhoods daily. Trains no longer running every 45 minutes, but instead between 7.5 and 15 minutes. The cost of riding the Fairmount line being the same as the subway fare. Operation at the same hours as the city's subway. Free transfers to all connecting trains and buses. 2 additional stations to be built to fill in gaps on the line, and ADA compliant platforms at all stations. It's critical to our success that we're always looking to build our base of community members joining us in this advocacy, and we do that by things like tabling at the Fairmount line stations, where we can share information with riders and hear their ideas and experiences. We also filed a bill in the Massachusetts State House that we collaborate with legislators on to hopefully get passed into law. Many of our campaign demands are in this bill. And right now, we're pressuring the governor to take action into her own hands and make our goals a reality. The benefits of a better Fairmount line are many, including removing a large source of air pollution from already suffering neighborhoods in Boston, creating a convenient transit option to get people out of crowded buses and traffic, and mitigating future harms from climate change. And additionally, there would be numerous statewide benefits from this campaign too, such as serving as a pilot for the electrification of the rest of the commuter rail system, immediately reducing the state's air pollution levels, and bringing Massachusetts closer to the ambitious climate and emissions goals it set for itself. So what's next for a better Fairmount line? We are waiting for the committee that's currently reviewing our bill in the State House to report it out, and hopefully they'll do so favorably, at which point we would push for the bill to be brought to the floor for a vote or inserted into a larger bill. We're always encouraging riders and engaging with them to bring them into our coalition along with residents along the corridor. And we're about to launch our campaign to pressure the governor to take action on our demands. We go about this work with numerous partners, and we try to always take advantage of the fact that there are often many avenues to reach one goal. So if you'd like to learn more about our work and stay up to date with our campaign for a better Fairmount line, I encourage you to check out our link tree here. And thank you very much.
Excellent. Thank you so much, Kendra. Great information, and I'm excited to ask you some more questions as well. But I do want to just give a thank you to our 3 panelists, and we're going to get them back up on the screen as we transition into our Q&A. But before we start with our question and answers, we do have a few questions that we want to ask you all on the call today. So we have 3 questions, and we want to learn about your perspective on 1, how climate, health, and equity are showing up for you. 2, where there are the Yes, those are the right questions. Okay, so these are open-ended. So the first poll was not the right poll, but you should see the questions of how climate, health, and equity is showing up in your community. What have you learned that you are planning to take back to your work? So if you've heard anything today where you're thinking, I might look further into that, we'd love to know what's sticking out for you. And then 3, what resources related to climate change your community is actually seeking. And we have an indication of some of those from the questions that you all have shared with us so far. But please take a moment to respond to these 3 questions, and we're going to get ready to jump into our Q&A. All right, so we have our panelists on the screen, I do believe. Yes, okay. There's everyone. I can see you all now. And so the first question I wanted to jump back into, because as you all were talking, we've heard from Gary about the high level of climate change, that it goes beyond just the melting of our polar caps, right? And then we heard from David about some of the partnerships that he's doing. And Kendra, you also talked about some of the specific activity that your organization is taking. But in each of these presentations, I heard something very specific about vulnerable groups, or groups that might have been historically under-resourced being especially affected by some of these climate impacts. So I wanted to come first to you, David, and ask, why is it that we are seeing vulnerable communities be impacted disproportionately by some of these climate effects? And then I'll also allow you, Kendra and Gary, to jump in as well.
Yeah, well, there's a lot of history with regard to how cities developed, specifically during the time in the post-World War II period when there was rampant housing discrimination and redlining. And actually, there are several examples of maps that show the relationship between the communities that were redlined and urban heat islands. And so just the discriminatory design of cities historically has resulted in certain populations, people of color, low income, being relegated to communities that lack trees, that lack green infrastructure, that lack parks, and so on and so forth, and then therefore have higher vulnerability to urban heat. And then of course we have I guess as a, not really a side, but we know that when swimming pools were supposed to be integrated, a lot of the pools closed rather than integrate in and near specifically African American communities. So now you have no place to go cool off or go swimming. So
certainly the planning.
And probably the most important issue that we have now is, you mentioned Justice 40. And so with Justice 40, they're using this climate and economic justice screening tool, which is not a GIS. It looks like GIS, but it's not. It's a data visualization tool that runs on a Mapbox platform. As the lead of the HBCU Environmental Justice Technical Team, my team has created an alternative tool called the HBCU Climate and Environmental Justice Screening Tool that does include race. That's the other thing. Race was not included as a variable in the CJIS tool, and that tool is being used to determine which communities are disadvantaged and thus eligible for the billions of dollars in Justice 40 funding. And I thought it would be just one of several tools, such as the CDC's Environmental Justice Index or the Environmental Justice Screening Tool. But from what I've seen, it's being used as literally a screening tool for who is advantaged and disadvantaged, but without having race as a variable, which goes against everything that we've ever read about environmental and justice research that says that race is the greatest predictor of whether or not you will be considered vulnerable. To not have that, as a variable, we're just going to ignore 400 years of history. It just didn't happen, right? So there are a lot of questions that are raised as far as the definition of who or who is not disadvantaged or vulnerable. And we really have to use every tool available to counter this non-racial lens that we try to cast upon determining who is vulnerable and who is not.
Yeah.
And David, I don't know if we got the link for that map that you're referring to with the race layer on there. I know we have one that is related to heat in urban areas, and I think that's been shared in the chat. But if you can drop the other link, that would be great. But Gary, were you going to jump in on the question as
I
well?
was going to say, I mean, I agree with David. I mean, it's a history of institutional racism in the country, in which this is just another latest manifestation. I mean, there's studies that have shown that some neighborhoods in Baltimore could be 5 or 10 degrees hotter on those extreme heat days than a middle-class white neighborhood. But it's not just about redlining. It's where are the diesel truck routes? You know, where are the fossil fuel? I mean, that's what Kendra's talking about. It's also where coal plants have been sited, where petrochemical plants, where refineries are. So, you know, you just have to go between Baton Rouge and Louisiana and New Orleans to see the national sacrifice zone that has been created by the fossil fuel and petrochemical industry. So at every level, the social determinants of health that so many of you are working on, climate is another overlay on top of that. So going forward, we have to link these things. We have to see that the social and environmental determinants of health are what we need to multi-solve for, and not see climate over here and the social determinants of health over there. It's just not helpful.
Thank you. And we do have another question that's been asked in the chat, and that is about sort of moving upstream. So some of the things that we have talked about is, you know, what are we doing after we see communities be impacted? But we know that when we move upstream, we stop some of these issues from being issues in the first place. So the question is, what are the most effective ways to implement some upstream solutions? And sort of reflecting on co-creating with communities together, what are some of the things that you all would recommend for upstream climate change solutions?
I'll just go through a couple in and to the others. I mean, helping people not only sort of detox their housing, in other words, leaky pipes, moldy carpet, inefficient windows, is linking kind of healthy homes initiatives with kind of climate resilient sort of energy efficiency strategies. So we're solving not only so that the toxics are not bringing kids to the emergency room again and again, but we're also trying to equip those housing units and those apartments with air filtration, with energy efficient windows, etc. So linking these things, linking food prescriptions for fruits and vegetables. So we're addressing and then working with community-based farmers, urban farmers, more racially diverse farmers to be the source of that food. So just sort of linking food, climate, transportation, energy as an integrated strategy that's addressing these upstream things. And what we're finding is that healthcare institutions and others, even now the Medicare Medicaid in Oregon, actually gave people energy efficient air conditioners during that heat dome. So there's a lot of stuff where I think we're in the very early stages of these interventions, but this is where it needs to go.
Thanks, Gary. David or Kendra, would either of you like to address that question?
I would just say to kind of piggyback off of what Gary shared, being proactive rather than reactive is also a good strategy. For example, community development corporations like the ones that make up our collaborative are also affordable housing developers, and they have housing stock that's much older. They're also building new affordable housing. And something that we're cognizant of is, like what Gary was mentioning, how to make that housing prepared for how climate change will continue to impact our communities. We have a lot of residents who don't have air conditioning, and we do free air conditioner giveaways and fan giveaways to try and support them in those really hot months of the summer. But moving forward, it's important to kind of act on those impacts that we're seeing right now and that we know will continue to get worse. And that's by building housing that is ready for these climate impacts and can make folks comfortable and safe and healthy in their homes.
Thank you. Well, we are getting close to the end. We promised that we want to end on time, but we want to just give each of our panelists an opportunity to say one last maybe takeaway point. There are several questions, so I mean, I promise to the folks on the call who have submitted questions, we thank you for those. We'll try to get responses to those as we can and follow up in our newsletter. But we are working on how we can get more Q&A time because the time does go really, really fast. But I just want to go back around to Gary, David, and Kendra. And if you will, just give us one takeaway that you would share with this group about climate change and health equity.
I think the core thing for people to walk away with is that you can't have healthy people on a sick planet. If our environment is poisoned, then we are also poisoned. We are not separate from the environment. That's one. The second is that we are the first generation of healthcare and public health professionals to understand that we need to operate at 3 scales: individual healing, community healing, and planetary healing. But every generation after ours are going to have to embed those 3 scales into how we revision what we are doing out in the world to be part of that healing profession.
Thanks, Gary. David, you're on mute. Go ahead. There you go.
Yes, I mean, we have to make sure that there's a better translation of science to or scientific facts to laypersons. I mean, that's the main thrust of the project that I'm working on with NASA is to, get rid of the misinformation and that leads to climate denial. I was in Atlanta and I had immediate pushback from some community-based organizations about NASA. And they said, well, NASA just has spy satellites and they're spying on us. Why are we working with NASA? And I had to diffuse that immediately. Also, just being an educator, we need more BIPOC earth scientists and atmospheric scientists. Earth science is the most underrepresented STEM field. We're at like 1.2%, but everything that we're dealing with is earth science, atmospheric change, hurricanes, flooding, increased intensity of rainfall. It's all earth science. We don't have scientists that we have earth scientists like myself that look like people in the community, and I can translate that message. It's received a lot better than, no disrespect, when someone like Gary rolls up in the community. No disrespect. I've been there. It's a different vibe, so.
Thanks so much, David. And Kendra, we'll give the last word to you.
Yeah, I would just say that it's important, particularly for the more people who are thinking of climate and health as very interconnected issues, that we always ensure that those vulnerable communities of color, lower or moderate income communities, are prioritized in solution visioning and in decision making, because when the communities like the Fairmont Corridor communities are being listened to, everyone is benefiting.
Certainly. Well, again, thank you all so much. And thank you to everyone who is on the call today. We know you could have been anywhere else for this last hour, so we greatly appreciate your time and participation in this webinar. Thank you. And please don't forget to fill out our survey for this webinar. And we hope you all have a great rest of your day. Goodbye.